it into its race-based policy that gave non-white patients priority for COVID-19 treatments. But that action only taken after a legal threat from a conservative law firm. Joining me now, Wisconsin Institute for Law and Liberty attorney Dan Lennington. Dan, why did it take your warning shot for the hospital to stop this?
Thanks for having me. Well, it seems like this is going on all across the country. We received a whistleblower complaint from a physician that actually works for SSM Health, and he was claiming that the distribution of monoclonal antibodies at SSM Health was based on race, and he provided me with an internal email showing something called a risk-based calculator. And under this calculator, a non-white patient is given a massive preference over a white patient. For example, a 50-year-old healthy African-American patient, a woman, would automatically be eligible for monoclonal antibodies under SSM's calculator, but an unhealthy 50-year-old white woman with diabetes, obesity, and hypertension would not. Another amazing example was that a 40-year-old African-American male would automatically receive monoclonal antibodies, but a 40-year-old white male presenting with actual shortness of breath in the emergency room would not be given monoclonal antibodies. This is profoundly immoral and unethical and illegal, and we wrote a letter to the hospital, and they immediately backtracked and disavowed use of this calculator going forward.
Okay, but Dan, you and I both went to law school. Day one of con law, constitutional law. You learn you cannot discriminate based on race. How did this pass the hospital lawyers in the first place?
Well, I don't know if it was evaluated by any hospital lawyers. This is sort of a trend that's going through healthcare. It's called health equity. It's the idea that there are racial disparities among patients, and so that you should give preferences to certain races over another. This has actually come down from a lot of state departments of health and CDC guidance talking about racial disparities and encouraging hospitals to take race into account when treating patients. But yes, it is illegal under the Affordable Care Act. It explicitly bans the use of race in the treatment of patients. There's numerous federal and state laws that prohibit this. And not only is it illegal, but it's bad for patients. The color of your skin is not a disease. Your race is not a symptom that needs to be treated.
Dan, what's next in the fight against these race-based COVID policies at the national level?
Well, I think the only thing that's really going to turn this around is going to be litigation that makes hospitals pay, that makes state departments of health pay damages, get injunctions against policies against the state where they require the use of race. At Congress, Congress should consider prohibiting this explicitly and taking away money and Medicare and Medicaid dollars from hospitals that do this. It would be nice to have an administration that was concerned with racism and health equity in hospitals, but we may have to wait a while for that.
Dan Lennington, appreciate your time this morning. Great insight. Appreciate